Hello, everyone. Thank you for joining us today. On behalf of the New York Water Environment Association, New York State Association of Counties, New York State Water Resources Institute, and the Syracuse University Environmental Finance Center, welcome to today's webinar on wastewater coronavirus surveillance systems, Advancing Research and Municipal Coordination, Part 2. In this 75-minute webinar, experts from Syracuse and Cornell universities, SUNY Oneonta, the College of Environmental Science and Forestry, and the City of Auburn will provide a follow-up to our conversation in June to continue the discussion of their experiences with the research behind wastewater surveillance for COVID-19 and its implementation at institutional to regional scales. The panel will be followed by a facilitated discussion with your questions. The New York Water Environment Association, or NYWEA, serves the best interest of the public by promoting sustainable, clean water management through science, education, and training. NYWEA serves over 2,700 members by providing opportunities to expand their knowledge and by cultivating a members forum for shaping an environmentally sound future. If you have any questions about NYWEA, please use the contact information shown and visit the website at nywea.org. The New York Association of Counties, or NYSAC, represents, educates, advocates for, and serves New York's counties and the thousands of elected and appointed county officials who serve the public. If you have any questions about NYSAC, please use the contact information shown and visit their website at nysac.org. Syracuse University's Environmental Finance Center and the New York State Water Resources Institute at Cornell University provide this webinar in partnership with NYWEA and NYSAC. You can visit our websites to learn more about our work to support water management across New York State. The collaboration for this webinar is supported under a grant by the Rural Utilities Service, housed in the United States Department of Agriculture at the Cornell Atkinson Center for Sustainability. For a few logistics, during the webinar today, everyone will be kept on mute to ensure audio quality. If you have a question, please type it into the GoToWebinar question dialog box at any time. We will be holding all questions for a facilitated discussion at the end of the panel presentations. We will also be posting the presentations as well as a video recording on the Syracuse University Environmental Finance Center's website. You will be receiving a follow-up email that will include links to all of these materials. Registered attendees can receive a certificate of attendance for participating on the webinar today. This webinar has not been submitted to licensing agencies for pre-approval of continuing education or training credits. If you require a certificate of attendance to apply for credit hours, please contact Seth Lisbon at the email provided on this slide. You can also visit our website at efc.syr.edu. And so, to jump right in to begin the discussion, we have one quick poll question for you that will help our panelists understand more about you. So the first poll question is, I'm so sorry, my screen is just a little covered by it. So the first poll question, are you currently taking any measures to track coronavirus in your wastewater? And we'll leave this poll open for a few moments here. And we'll get ready to close this poll in 3, 2, 1. So for folks and panelists on the line, 31% of attendees have submitted yes, 18% have submitted no, 13% are exploring their options, and 38% have selected not applicable. So at this time, we're going to switch over to the panelist discussion, who will share their advances in wastewater surveillance by briefly reporting on research, coordination, platforms, case studies, or resources. Kristen Hitchka with the New York Water Resources Institute at Cornell University will help facilitate these short presentations in the following question and answer discussion. So Kristen, I pass everything over to you, and please take it away.
All right. Hello, everyone. Just very briefly, I wanted to thank you all for coming. Sounds like a great audience from all over the country, actually, and with a broad background of experience with wastewater surveillance of COVID-19. Very briefly, as an overview, so SARS-CoV-2, the virus that causes COVID-19, is highly infective, oftentimes is transmitted before symptoms appear, and has severe outcomes that can overwhelm medical resources. As we've all seen, it's caused crippling socioeconomic impacts in New York State and across the world. And during the unfolding of the pandemic, both developed and developing countries struggled with detection of cases due to the practical limitations of medical screening. One method for community-level monitoring of the virus is wastewater surveillance, a powerful and relatively inexpensive informational tool that can provide data on how a virus is circulating within a community. Some of the things that wastewater surveillance for COVID-19 can't do is it can't determine exactly who might be infected, so it can maintain privacy in that way. Samples are a composite sample. It can't conclusively determine if an area is COVID-19 free, but some of the big benefits and things that it can do is it can be done cheaper and faster than comprehensive clinical screening, account for those who have not been tested or have mild or no symptoms, differentiate the beginning, tapering, or reemergence of an outbreak, estimate the probability that an area may be COVID-19 free, and really the biggest thing is allow for early detection of outbreaks 1 to 2 weeks before people with infection start exhibiting symptoms. And the benefits of this early warning to allow for public health containment measures can be substantial, with potentially steeply reducing the number of cases and deaths from COVID-19. So that's the reason we're all here. And our intention with this panel and possibly subsequent panels is to facilitate a dialogue between researchers and practitioners to promote effective wastewater surveillance as a tool to help reduce the spread of COVID-19 in New York State and beyond. As Savannah mentioned, we're building on presentations given in June by this organization, and then also by the New York Association of Counties held in May. We have a very strong panel. Some of them are returning from most of them are returning from our panel in June. It's a good mix, I think, of academic researchers and practitioners. They work across spatial scales, and they provide a range of expertise, so which is going to be needed in implementing effective wastewater surveillance program. So while there's deep and broad expertise on this panel, I'll just want to make sure that everyone knows that everyone in the audience brings their own particular expertise to this discussion. You know, you all have your own knowledge of your specific facilities, the effects of precipitation on flow rates in your facilities, or dealing with your county legislators. So we're really interested in thinking of this as a dialogue. And so we look forward to your comments and your questions when we get to that part of the discussion. So let's see, I'd like to now introduce our panelists. I'm going to start with David Larson. David Larson is an associate professor in public health at Syracuse University. He specializes in global health broadly, with specific expertise in surveillance, control, and elimination of infectious disease. And sorry, I'll add at this point, each of the panelists is going to give us a short 5-minute introductory discussion, and then we'll get into discussion after these brief intros. So David, take it away.
Thank you for having me back, and it's good to talk with everybody. So I'm Dave Larson. I'm an epidemiologist, and come at this from the infectious disease angle. How do you use the data? What do you do with the data? And worked with a team here. You know, my involvement in wastewater surveillance began in March, once the proof of concept was shown in the Netherlands that this could be done. And I knew from that, based on my experience with global health, wastewater surveillance was widely used in the 1990s to combat polio. And because polio, only about 1 in 200 cases results in paralysis, you can monitor transmission in a community, and when it was detected, they could rush in and do vaccination campaigns and actually prevent paralysis cases. And so we're trying to build this platform for the entire state of New York, and it includes that early warning and then the confirmation of control as well. And so the early warning is often what gets talked about. I really like negative results, and so how can we use when we don't see it in the wastewater, how can we build confidence that we can reopen our economies or keep our economies open, our schools open, and then still have that early warning when we might need to pull back on those, and then what kind of interventions can we deploy when we do find it. And so thank you for having me, and happy to be here.
Okay, David, is that your talk?
That's my talk, if that's enough. I can talk more if you need.
No, yeah, you're welcome to give a brief update, or you can give that later in the discussion period.
Yeah, so I guess an update on our team. It's a collaboration with SUNY ESF, SUNY Upstate, and some industry partners. We wrapped up a State Department of Health, New York State Department of Health pilot that was ongoing, and now we're pushing the state to adopt a statewide platform. My dream would be a wastewater surveillance measure for every zip code, to have that level of data for communities to understand what's the risk of a parent having their kids play together, the neighbors play together, what's the risk of going to the playground, what's the risk of different activities. And so we're pushing the state, about to put out a state proposal white paper, and we hope that they pick it up. At Syracuse University, we've used wastewater surveillance in 2 ways. One way is it prompts us where to test, but then the other way is this negative results. We had a super spreader event at Syracuse where about 80 cases came from a single case, and it's a bit of a panic. I think some of the folks on here can attest to that when you see this huge spike in coronavirus transmission. And immediately we looked at, well, what's our recent results from wastewater? And we saw that the dorms were clear by and large. And we thought, all right, let's get our hands around this outbreak. Let's trace it out, lock it down. And we're able to do that and stay open. And so I can't emphasize enough the economic value or the peace of mind that comes from having this system in place to not only give early warning, but also to confirm that transmission is low. It's a real value that I see. Yeah.
Fantastic.
I don't know how to close, so that's all. I'm happy to take questions after, thoughts after.
Okay, that sounds great, David. We'll move right into the next speaker. It's Hyatt Green. Hyatt's an assistant professor in environmental microbiology at SUNY ESF in the Department of Environmental and Forest Biology. He and Dr. Frank Middleton at Upstate Medical University developed the sucrose cushion method to isolate and quantify SARS-CoV-2 RNA from wastewater that is currently used throughout New York State and elsewhere. Go ahead, Hyatt.
All right, thank you. And it's a pleasure to be back with everyone. I should say I'm feeling a little under the weather today, so if it sounds like the Sudafed is talking, that's because it is. I view our task as to provide the data that the epidemiologists in our group need to help fight the pandemic. And so primarily, of course, that's pulling SARS-CoV-2 wastewater from RNA. But we think it's probably a little unfair to compare those RNA concentrations from site to site but also from place to place without having some way of accounting for both decay of the virus and its RNA, but also its dilution in the wastewater system. So early on, we devised a way, or we asked if we could use an organism called crassphage to help account for both decay and dilution and everything that SARS-CoV-2 might be experiencing within the wastewater system. So in other words, to sort of act as a surrogate organism. We thought we could do this, and others thought that could work for them as well. So Dave mentioned researchers in the Netherlands. So Medima and colleagues, they also started co-quantifying crassphage, and they found that that SARS-CoV-2 RNA adjusted for crassphage really showed what I think is a remarkable correlation with both case numbers and hospitalizations in that image that you see on the right there. That kind of lack of correlation towards the beginning, where you see the orange line is much higher than the blue line, they blame that on there's not enough testing. They didn't really know the full extent of spread at that point. So we want to ask, well, we know that helps improve, or that can help improve the variability in some of the data, but is that organism really the best surrogate to use, right? There are others that we're interested in testing. Do they have to be viruses? Do they have to be viruses to humans? Do they have to be, can it be human genes that act as surrogates? So we're exploring those questions right now. The other thing that I'll mention is that it always kind of feels that we're letting a lot of information potentially slip through our fingers. So we're interested in asking if we can use wastewater to look for other pathogens. Can wastewater help us gauge the level of immunity in the community? Can we detect different strains from wastewater? So these are some potentially very important questions right now, but also especially when we think about the rollout of a vaccine. Can wastewater be helpful in structuring that rollout? Can wastewater be informative in how effective the rollout of a vaccine is? And so right now, there's no doubt that the detection of the virus itself is obviously very important in a wastewater context, but there's probably a lot of other information that we're letting just flow downstream, so to speak, that we're not capturing and using. Thank you.
Great, thank you, Hyatt. Before I go on, just two quick comments. One, just in the chat, keep an eye there. Meredith just shared something about Syracuse University experience with wastewater surveillance of COVID-19. And then there's also a box where you can be putting your questions in. So under the questions, you can submit a question as we go. So our next speaker is Anthony Hay. Anthony Hay is an associate professor of microbiology in the Department of Microbiology in the New York State College of Ag and Life Sciences at Cornell. He's an environmental microbiologist with broad interests in soil and water.
Thanks, Kristen, for having me, and thanks to the other panelists, to David and Hyatt for setting the stage. I apologize. I feel like I showed up overdressed for the event here. So I'm going to share with you a few slides, and I hope that won't put people off. But I just want to acknowledge the folks that have helped with this work. Chris, who's done most of the sampling. Jose is our collaborator down at our wastewater treatment plant. And I can't emphasize enough that even when academics get involved, we can't do it without help of municipalities. And and also obviously some support. And in this case, our small effort's been supported by our vice provost for research. So one of the questions I get when people learn that I'm doing this work, they're like, are you afraid of getting sick? And so I just thought I'd share with you this recent study that was published, just showing that luckily for us who are interested in the detection, the detectable RNA hangs around lots longer than infective virus does. And so for those of you that may be worried about the health of your employees, or those that might be working in the municipal wastewater treatment plants, there's, to date, to my knowledge, there's no evidence that anybody at a wastewater treatment plant has been infected. There are a couple of putative examples where feces did cause infection, but the infectivity decays at a much faster rate than the RNA. And as you'll see from our work, we're having trouble detecting RNA. We're one of those examples that Hyatt and David pointed to of negative results. So in our case, we're collaborating with a local wastewater treatment plant, taking 24-hour composite samples a couple days a week. And that's one of the questions you may be asking. It's like, when do you sample? Do you sample right after breakfast? We see differences from day to day repeatedly. So we have a weekend poo sample and a midday poo sample from the middle of from our Tuesday collection, and it's different every time. Questions you might have about it, how much can you possibly process? We're working with 45 mils, which is about, I think, what Hyatt was working with. In our case, we didn't have the ultracentrifuge that is being used for the sucrose cushion method, so we wanted to take the approach of how would we spin out a method that would be reliable, that could be adopted in a low-tech fashion by other small universities with a biology lab or a county health department, or even a wastewater treatment plant that has molecular detection capabilities. And that would be amenable to inexpensive scale up and produce a sample that could be integrated with automated analyses. We're privileged at Cornell to have a veterinary diagnostic lab that got conditional approval from the FDA to run sampling. So we have this enormous sampling capacity, but they don't do sample processing. So envisioning a way to hand off samples that are processed by well-trained environmental technicians that could then be integrated in with an existing workflow for analysis of human samples. And just sort of trying to envision an adoptable standard operating procedure that could be deployed by universities, smaller wastewater treatment plants, and county health departments. That was one of our goals. So I don't want to spend too much time on our process, but I just want you to see the difference. This is our representative of our Monday sample. This is representative of our Tuesday sample. And I don't need to tell those of you that are practitioners, but there's a real big difference in day-to-day sampling. And when you're trying to coordinate with your county health department, making sure they're aware of your expertise and your understanding of what the typical flow rates are, what the typical consistencies are, and how you might expect to see differences in the input. In our case, we filter this through a disposable filter that's 0.2 microns, so basically pulls out all the bacteria. Then we put it through what's called a centricon, or a centrifugeable filter, and retain everything that's virus particle size. And we work directly with this, and it's relatively rapid. You don't need much more than a vacuum pump and a low-speed centrifuge, which is available at a lot of these facilities. So that was our approach, our strategy. And then our detection method is very similar, I think, to what Hyde and David have been deploying. In our case, we have not detected SARs in Ithaca wastewater treatment plant. And how do you know when you have those negatives that your system is working? And I appreciate Hyatt talking about crassphage. We've also used that, adopting some of his methods. And then, like them, we've also tried to look for other surrogates that might be more biologically similar. So in our case, we settled in on pepper mild mottle virus because it's an RNA virus, much more similar in structure to SARS than is the bacteriophage. But I think, as you'll see, they both track fairly well with each other. And then, of course, we're doing standard curves for COVID and one protein every time we we do this work. And you can just see the trend over the last couple of months. Blue is for our crass phage, so our numbers are fairly constant. We do see a little more fluctuation in the PMMV, so the pepper virus, which is like the crass phage, has been used by others in the wastewater community for monitoring viral persistence. So thinking about what a negative looks like, I think that's one of the stories we can share with you is just that if you do have negative, and hopefully that's where you get to, how do you know, or what level of information does your negative actually mean? And it's important to realize that negative doesn't mean virus-free. And so I think that's an important caveat. Kristen mentioned that ideally, wastewater treatment surveillance could tell you an area is virus-free. I would say that what it can tell you is it's below your detection limit. I think it's an important distinction. What are the things that actually affect that? And Hyatt touched on this briefly, but I think this heat map is really useful for helping people to conceptualize what's going on. We have a relatively high flow rate. We process about 420 liters per person per day, according to Jose Lozano, our collaborator down the wastewater treatment plant. We also have relatively mild cases and relatively few cases. So we have lots of asymptomatic and virus people that shed less virus. Virus decay rate is one of those things that needs to be taken into account. But when you consider all of these contributing factors, it helps you to put in perspective what level of virus you can reasonably anticipate detecting. And in our case, we really feel like we're in this range here, where maybe we'll get 1 in 4,000, 1 in 5,000, or 1 in 500, somewhere in that range. And I think it's important to have an idea, if you're going to be adopting this type of monitoring, that you have realistic expectations of what you can and can't do. Just to give you an insight as to what's going on locally, and this data, I downloaded it today from the Coronavirus Healthy New York COVID Alert app, and I will get on my soapbox. What you see on the upper left-hand panel is the results from Tompkins County, where I live. You see the one-time spike we got from a scare from 36 students that tested positive after getting together for a party, not socially distancing and not wearing masks. You can see that our percent test positive rate, 0.05%, is 100 times lower than that of neighboring counties. And I'm not going to call any of them out by name, but so our failure to detect is in part due to our very low positivity rate. The other thing to consider is what are the actual test rates going on? And you can see at Tompkins County, we're testing more than 5,000 people a day. The next closest would be one of our neighboring counties, but in several of the counties with the highest rates, you can see that that's, again, orders of magnitude lower. And so the challenge is, how do you marshal your limited resources? It's honestly not realistic, I think, for everybody to think that they're going to try to replicate what's happened here at Cornell. I mean, we really make a great case for test and trace, but that's not available financially for everyone. Cornell has gone into debt or has expended a lot of financial resources, I won't say they've gone into debt, to actually put in together a test and trace program. I get tested twice a week. All the students on campus get tested at least once a week. And you can see that our actual positivity rate, actual cases, is well below even our most optimistic projection. And that, I think, speaks to the foresight and the planning of our administration and the technicians behind the program. So Cornell, we've chalked up this rare victory in containing COVID, but it's not financially accessible to even our neighboring counties. And so we're reaching out to neighboring school systems to try and be of assistance there. But how do you marshal the limited resources that you have? And once you have obtained useful information, whether it's from direct test and trace of individuals or from community level surveillance, how are you going to use those positive test results? And I'm going to sort of wrap up here on my soapbox and just say that the utility of community level data, which isn't foolproof and has some limitations, but is very useful, is dependent upon what you do and how you plan for community level response. Questions I would leave with you are, what public health measures are you promoting to curtail the spread? And then how are you taking advantage of technology to perform contact tracing? We hear daily in the news how our neighboring counties are overburdened and behind in their contact tracing. Really, I think in order for sewage epidemiology to really be brought to bear in a meaningful way on reducing transmission rates, contact tracing apps need to go viral themselves. So it's really a bottleneck in tracing that is going to reduce the efficacy of any of the good work that you plan to do. So I hope that as you're advocating for resources to get information, whether it's by direct testing or via sewage epidemiology, that you're also talking with your counterparts about ways of reducing transmission rates and improving contact tracing. So I apologize if I went a little long, but I'm happy to take any questions if there are any, or just wait till later.
Yeah, thank you, Anthony. I think you brought up a lot of topics we'll circle back to. That was excellent. But we'll hold the questions till the end. We'll have our last researcher present. Tang Zhang is an assistant professor of environmental engineering at Syracuse University. His group performs wastewater analysis to assess the population level substances using to identify trends. So take it away, Tang.
Good afternoon, everyone. I'm not sure if you can see my screen though.
Yep.
Yes, we can.
Oh, okay, great. This is Tang Zheng from SU. I'm working with Dave and Hayat as part of the SARS surveillance team here up in Syracuse. Our group is interested in wastewater chemistry. So specifically, we are interested in looking at the analysis of different types of chemical substances that are present in wastewater samples. So we recently did a case study here in Onondaga County, and we were trying to see what types of relationships we can see between the substance consumption rates in the studied sewer shed and the COVID-19 prevalence. And so the slides I'm showing you up here is just a kind of a schematic of what we try to do, as well as a summary of results. And essentially what we found was that we did observe some strong relationships between COVID-19 prevalence as well as the consumption rate of several major substance groups. And we thought this was somewhat interesting. But on the other hand, this is also a very limited scope study. So we hope we have the opportunity to expand our study in the near future. And lastly, I also want to acknowledge the wastewater treatment plant operators who help us collect samples, and also our other team members who help with sample analysis as well as data sharing. But I guess I will just end here for other questions.
All right, thank you. We'll come back to those questions. So, okay, so those were our researchers on the panel. Now we'll speak with we'll have our practitioners introduce themselves. So the first one will be Seth Jensen. He's a PE and has been Director of Municipal Utilities for the City of Auburn for 4.5 years. He's been with the city for more than 10 years, where he previously worked as an engineer in support of the city's water, sewer, and hydroelectric facilities.
Thank you, Kristen.
Yeah.
So the City of Auburn, by way of background, owns and operates a 12.4 MGD activated sludge wastewater treatment plant. We serve approximately 45,000 Cuyahoga County and City of Auburn residents. And in May of this year, amidst the COVID crisis, I had read a newspaper article in Syracuse.com that noted Mr. Larson and his team were doing COVID sampling in wastewater in Onondaga County, and I reached out. So in May of 2020, the city of Auburn partnered with Professor Larson and his great team, pulling samples on a weekly basis. And since then, we have been doing just that. We haven't stepped up the sampling to more frequent than that. However, we did initially start by taking a composite sample of our wastewater influent as it enters the wastewater treatment plant. And then we had broken our sewer collection system up into 3 major categories with 3 separate interceptors. But we were, excuse me, unable to pull composite samples at those manholes because we didn't have the equipment. So some considerations, I suppose, for folks who are interested in the COVID sampling would be just that. You need to have specific equipment required to pull a composite sample. The city of Auburn only has 1 at this time. I believe Professor Larson has worked with his team to develop some simplistic yet effective composite samplers for manholes that you can build basically by going in onto Granger and ordering the parts and pieces and components that you need. So that could be some interesting information for folks as a follow-up to this presentation, some information on how to build a manhole composite sampler that's affordable to participate in this program. Other considerations is your in-house capacity, right? If you're a smaller wastewater treatment plant that's made up of 1 or 2 staff members and you need to collect and deliver samples on a weekly or twice a week basis, that could be a little bit difficult for some municipalities. Auburn is kind of in that sweet spot where we have available staff to not only collect but also deliver the samples to Syracuse University on a weekly basis. Back to the cost of the composite samplers and costs in general, another consideration for folks would be just the cost of the samples themselves. The city of Auburn has been sampling weekly at around $200 per sample. I've heard that those costs kind of range between $200 and $400 per sample at the lab. So, you know, with a willing county health department and a partnership like that, that helps with more parties paying in on that fee. But certainly something to keep in mind. Lastly, another final consideration that I think is probably important that helps our partners, our project partners in developing their areas of service is if you have GIS mapping already of your collection system and you can provide that to Mr. Larson or another team that you're working with so that you can develop your sewer shed areas. Sorry. Sorry about that. So that you can develop your sewer shed areas quickly, effectively, and also be able to tie the data of cases in the field to the sampling or the collection of data that you're providing to Mr. Larson and his team. A quick example that I wanted to share with everybody today, although it's not necessarily quantifiable, it's exactly or precisely what piqued my interest in the first place with this program was that the city of Auburn and Cuyahoga County have been extremely lucky, or were very lucky over the course of the summer. We had very, very low positivity in the healthcare system. Not a lot of people developing COVID-19, and that continued until about the first part of October. Since we've kind of hit October, our numbers, although they're not terrible, have sharply increased. And there was a conversation in mid-September with Professor Larson and his team, and emailing back to the county health department and myself because we had a significant hit in our wastewater. That was about a 2-week advance kind of heads up, 1 to 2 week heads up. And for me, and being able to communicate that information to the city of Auburn and our local leaders was very useful information to, be reminded to stay the course, continue to socially distance, stay away from large groups and gatherings. So for Auburn specifically, although again, not quantifiable, it was extremely, in my opinion, important information to have a week or two in advance to actually seeing the numbers rise in our health system. So again, kind of to wrap things up, our experience and benefits, obviously being able to predict outbreaks or track them a bit in advance is extremely important for communities. It's a relatively inexpensive tool, I think, and if you have the capacity to participate, I'd recommend it. Professor Larson and his team have been absolutely wonderful to work with over this past summer, and I really appreciate the experience and look forward to any questions you might have. Thank you.
Fantastic. Thank you, Seth. So our last speaker today is Lachlan Square, and he's the Chief Facilities Planning and Safety Officer at SUNY Oneonta. Lachlan has been with SUNY Oneonta since 2017 and has over 20 years experience in higher ed facilities planning, design, construction, and facilities operation, as well as extensive prior experience in heavy industrial construction management. Go ahead,
Hi.
Lachlan.
Hi, everyone. I just wanted to speak to our experiences with wastewater monitoring. We became interested in wastewater monitoring in early June of this year when we started to see some press reports about that. And we eventually became connected with Quadrant Biosciences. So we purchased 3 commercial style wastewater auto samplers, and we installed those towards the end of July of this year on the 3 outlet points from our campus. So we started wastewater monitoring in early August, and with Quadrant and Dave Larson, and we established our baseline for wastewater monitoring. And when you talking about monitoring campuses, it's a much smaller area, smaller population. It's a little bit more granular. And I think, we initially struggled a little bit because the students were not back. There was fairly low flow rates. So the students moved back in about mid-August, and towards the end of the first move-in week, we noticed a positive for COVID RNA in our wastewater. So our plan was to do overall campus monitoring with wastewater and have pool testing ready to mobilize if we started to see an uptick in the wastewater. So late in move-in week, we saw a slight positive on the wastewater, and we made the decision early the following week to start to mobilize our pool testing. And then at the same time, we saw our first sort of quantifiable level of wastewater. And about mid that week, we had a fairly explosive growth of COVID. Between our on-campus and off-campus population, we had about 300 cases in the first 6 or 7 days, and 700 cases overall in about 2 weeks. So the wastewater monitoring did give us the heads up on it. It started us in the process of mobilizing for pool testing. It also, once we also contacted SUNY, and they provided us with a lot of SUNY Central provided us with a lot of assistance in really gearing up our pool testing. Our pool testing plan was just based on surveillance, not testing whole on-campus populations. So we had 2,100 students that we had to actually over that we had to test in a very short period of time. So we had to really gear up our pool testing. It did give us an early warning. Unfortunately, our replication rate on our outbreak was 4.2, which is quite something to experience. So one of the interesting benefits, though, of it, we did see the actual spike. When the actual spike in COVID wastewater came through, there was a lag time. So the indicator for us, because our outbreak was so explosive, was really those initial low-level positives. But we ran the course of the outbreak, and unfortunately, most of our students had to return to their homes, but we did still have a residential population. So we've been able to monitor that population in 3 different residence halls and monitor the level of COVID RNA that's post-infection shedding. So those students are all being tested weekly, so we're certain there's no positives amongst them. We've actually been able to see the post-infection levels decreasing, which has given us some confidence in current situation. The interesting thing about our situation is we have a lot of wastewater data. We took a lot of samples. Once we saw those first positives, we increased the frequency of sampling. So we have a lot of sampling. We also moved our units around campus. We actually have some very good data about upstream populations in terms of number of positive cases upstream, total populations, and we're working to pull some of that data together at the moment. But it was certainly beneficial to us, and I think when we had to, in combination with some other information we had about where we thought the outbreak was coming from, we also had indicators from one of the wastewater sampling points that there was a much stronger hit in that area. So that was actually enable us to target our pool testing and prioritize that to those particular residence halls where it was clear that the outbreak was stronger. So it's certainly, like I said, it's been a useful thing to us. I think it probably, if we had been dealing with more sort of slow growth outbreaks, it would have been even more useful in terms of trying to track down 1 or 2 asymptomatic students in a particular residence hall. So I think that really sums up our experiences.
Thank you so much. Well, that's an excellent group of thoughts, and we have questions coming in. Please feel free to put more in the question and answer area. We have some that came in with registration, but for now I'll pass this over to Savannah for one more poll question before we come back for discussion.
Thank you, Kristen. So we are just launching one last poll question. This is a select as many options as you feel necessary. We're just looking to ask, what topics related to wastewater surveillance would you like to see for a future panel discussion? And we'll leave this poll open for a few minutes since there are quite a few options. And just a few more moments here. And if at any time you weren't able to select an option to either of the poll questions, you can reach out to us via email. And we'll get ready to close this poll in 3, 2, 1. All right, Kristen, I pass it back to you to jump into the discussion.
Wonderful. All right, so panelists, if you would, yeah, turn on your, if you can, turn on your webcams. So we have a whole range of questions, and you brought up a lot of great topics. We have a fair amount of time. We have until 3:15, so hopefully we can get to at least most of your questions. I'll start with a couple that came in recently. One, maybe to Anthony. Others might be interested in answering this too. It's basically your discussion about detection. What is the best estimate of the % of the population that is infected to be able to detect COVID in wastewater? So maybe if you could elaborate on that a bit.
So I don't think anybody has a good number on that, independent of those parameters that I talked about. So you can't have a blanket detection limit for populations that might be very sick versus those that are asymptomatic, or even if you don't know the attributes of your own wastewater treatment system. So dry areas might have flow rates in the order of 50 to 70 liters per person per day, whereas Ithaca's is almost 10 times that. So I would encourage you, I think the slide has a reference there. I think that Holden paper paints the parameters that are necessary to be considering it. That heat map is, I think, a really useful tool for this discussion for people to realize your detection limit's not going to be driven by the number of people necessarily that are, just by the number of people that are infected, but by these other parameters as well. Sorry, it's not a simpler answer.
No, Anthony, do you want to share that slide one more time? You have another question about a different slide, so it might be good to show that slide once more.
Yeah, give me 1 second here. So this is the slide I was talking about. Are you letting me share? Okay, there we go. So this paper, 2020 paper by Hart and Holden, and you can see that over a little bit. Sorry. Boy, I'm challenged here. But just you see on the right-hand side the theoretical detection limits. Oh man, sorry everyone. So these numbers would, how many could you detect? You could detect 1 in 4,000 cases if you're in this yellow range here. So that range goes over sort of a 50-fold range of virus shedding and about a 5-fold range of flow rates. So it's the combination of those things, and then other things like temperature and UV. So there are multiple components not even mentioned on this slide that really come into play when trying to evaluate your detection limit. And that's one of the reasons I shared the information on our own percent positivity rate. You see 0.05%. So that's that's 1 in 10,000 people, or 5 in 10,000 people. So we're nominally in this range where the yellow is. So we're sort of right at what is likely our limits of detection.
Great. So maybe keep your slides up, Anthony. But David, did you have a comment you wanted to share also about detection?
Yeah, and I come at this differently. I think Anthony's you're a microbiologist, if I remember correctly, and this is a very microbiology approach to this. From an epidemiology perspective, we just look at the cases per population. And wastewater surveillance is a surveillance system. Every surveillance system is imperfect. Just like our cases that are reported through the health centers are not going to catch everyone. They're not going to catch everyone in terms of asymptomatics, those that don't want to go get tested, those that are afraid to get tested, those that don't want to get quarantined or isolated. All those factors play into whether somebody actually goes and gets tested. And then you have false negatives in some cases. And so that system is imperfect. And then the wastewater system is also imperfect. We have the fecal shedding and the size and all these other variables are very influential on how much RNA can be recovered. When we look at the data that we're seeing across upstate New York, we're getting a consistent detection level of about 1 reported case per 10,000 population in the sewer shed. And so that, I'm guessing it's pretty similar to what you have there, Anthony, in terms of the 1 per 500 infections, just based on the data reporting. But that's 1 per reported case. Now, from a public health standpoint, how valuable is that? You know, we know that one of the values in coronavirus epidemiology that is not well appreciated yet, it's getting there, is the K value, which is the super spreader value. And we've heard that term super spreader thrown about. But what that means is that the vast majority of cases might transmit to one other person. And then you get this really small percentage of cases that might transmit to 50, 100, but more than 5 or 6 people, right? And they're the super spreaders. More than 10 people is often a common definition. And so can we detect that growing cluster is where I think about the sensitivity. And is it at that point where we can give forewarning of an increasing cluster, as opposed to getting hung up on how many, if we could detect 1 case? Because I don't care about 1 case. What I care about is that case going to exponentiate like we've seen in Oneonta, like we saw at Syracuse University, or is that case just gonna be a dead end transmission chain? And so can we detect that? How early in that exponentiation can we detect it? And so we're still working out on that science, but it looks like about 1 case per 10,000 is pretty consistently detected.
Thank you.
I think that's the value of David's much broader database. We've got one location and 1 community, and so I appreciate hearing that. Thanks.
I think I'm actually going to go, there's a question here that's a little broader and maybe more on the practitioner side of things. They're wondering, what is a good way to coordinate with other public agencies once the coronavirus RNA is discovered in a participating wastewater system? I'm wondering if, Seth, you might want to talk about that. You may have the most, and maybe David also.
Yeah, you know, for the most part, any coordinated effort with respect to response, we've always left up to our health department. So I'm not exactly probably qualified to answer that question. Sorry.
So you just share the data directly with your health department?
We do, yeah. So, you know, like any other type of sample that we might do on our water filtration plant side of things, we had a HABs issue with Owasco Lake. All of our sample data that we collect is just turned over to the health department. There are public communicators. That's what they do for a living. And we allow them to handle any bit of that information and digest it and utilize it how they see fit.
Does anyone else have comments about communicating between the samplers, the data collectors, and the health response side of the equation?
Yeah, I'd like to comment on that. This is Dave again. I really see the stewardship and the ownership of these data in the realm of the health department, the local health department, right? The utilities and wastewater folks, the engineers, they're needed to collect the data and their input on how to do this, and it's a very important partnership. But then what do you do with the data? That is the purview of the health department. And here in New York, the state health department is beginning to come together on that. So there's folks that are assigned from the state health department to look at wastewater data and to help the different municipalities and counties think through that. And then nationally, the Environmental Protection Agency has really partnered with the state of Ohio. And there's a number of different resources that the Ohio State Health Department has in terms of templates for press releases, how to talk about these data. But the first thing before you start pulling data is to reach out to, or before you start pulling wastewater, is to reach out to the public health department and to really build that collaboration to make sure that it's working well.
Excellent point. Yeah, and Ohio State, the state of Ohio does have a lot of excellent resources, including a great dashboard for sharing information. Let's see, we got another question here. Can you explain why reporting of analysis is always just concentration and not, excuse me, grams per D being detected? This would avoid challenges due to wet weather days when the flow could double and the concentration drop in half. Still the same amount of virus. Couple thoughts that kind of embedded in that question. Does anybody want to take a stab?
So what was the question again? That sounds a little my realm, but.
Okay. It was about reporting just in terms of concentrations.
Yeah. Well, there's, and I would say we haven't quite figured it out yet, right? I mean, the most common way to report this data is genomes or viral copies per milliliter or per liter. We've also reported it, in terms of a ratio, but I think the data is still out, whether that's a valid, reporting unit. Per gram is a little tricky, right? Because that's as Anthony showed in his his filters there, the composition of wastewater really varies from sample to sample, and it's liquid and solid. It's a biphasic matrix, so that could be a little tricky. When we think about shedding of the virus, we definitely talk about it in terms of per gram. Shedding SARS-CoV-2 viral particles, and that unit is helpful at some stage in the process. But I'd say, it's a great question. I would say we're still trying to think about it. And the wastewater engineers, they think about volume, more so gallons or millions of gallons, right? And so we have to think about a unit that links in to that existing body of knowledge, right, at the wastewater treatment plants. So there's multiple factors to consider here.
I would just say that Hyatt's approach of using crossphage as a way of normalizing for dilution and all these other factors, I think that's what gives confidence in the data when you're making comparisons, and so that should account for dilution, especially now decay due to other things like UV or temperature. They might decay a little differently, but I think dilution, especially crossphage or some of these other wastewater indicator viruses like PMMV, they account for that. Of course, getting back to a number that means something to our engineers is important, and I think Hyatt makes that point in a really valid way.
I think following on to that, the question is that cross-phage detection technology available currently, and does it change the way you sample?
Yeah, good question. Yeah, that is available. The assay that we use was developed at the EPA lab in Ohio that Dave mentioned, in Cincinnati, and it's published and available to use. I think it's maybe 2017 paper by Elise Stackler. And you can grab the primer sequences and the probe sequences and the conditions that are used, and and we pulled it right off the shelf, and it worked just great for it right out of the box. So so that is available. Does it change the way that sampling is done? No. I think it's important to keep the methods for whatever surrogate is used and SARS-CoV-2, keep those methods the same. The whole idea is that crossphage or PMMV acts as a surrogate, and so we want that surrogate to reflect the environmental conditions, right? Decay and dilution, but also the sample processing that happens in the lab and sample collection too. It doesn't change. You don't have to change much. You don't have to change anything. And probably, minimal changes should be made.
Just to echo that, I mean, we tried just multiplexing our CRAS and our N1 detection and saw a little bit of interference there. So, even modest changes that you would think shouldn't have an impact on the outcome, they need to be validated before they become integrated into your platform. And there we were using the exact same extracts that had been processed and and then divided up, but those small changes can have an impact. So for those of you who are technicians and might be thinking about that, I think there's a good online community where people are having discussions about using these kits that come that are readily available. Like Hyatt said, the primers are available. They work out of the box. You don't have to do much. But when you do make even small changes that seem reasonable, you have to validate them.
Makes sense. So back to the practitioner side, thinking about funding, the question is, what are some potential avenues for funding wastewater surveillance for municipalities? And what approaches have practitioners used to convince their funding sources, municipal or institutional, to implement surveillance programs? Seth again, or anyone really?
I can try, and that's a really good question. And when we first started this in May, we were lucky enough to be able to rely on Professor Larson and his entire team to do the sampling for free. Obviously, as time goes on, that's not sustainable, and we had to begin to pay for the samples on a weekly basis. That was a presentation to City Council and a discussion with them to see if they supported it and to get their buy-in, which they did, and coordination with our health department as well, and working out a cost-sharing matrix that is working for now. It's not sustainable, but it's going to get us through Christmas, right? And then we'll continue to see what happens. I know Professor Larson and his group have been working tirelessly with state and federal politicians to see if there's opportunities there through grants or other assistance, and I'm sure they can talk maybe more about those opportunities or efforts at least, but at this point it's been at our cost since late summer.
David, you had something to add?
Yeah, so I'll jump in here. The CARES Act can't fund this. So the state of Michigan, the state of Ohio are using CARES Act dollars. Different communities, I know the counties that received the CARES Act had to have a 500,000 population, but different communities, counties in upstate New York are using the CARES Act money to do this. And then there's the next stimulus package, which I think most folks agree that there's going to be another one at some point. And so that would be a chance to lobby Congress to put together another stimulus package like the HEROES Act or something similar. At the New York State level, we're working on an uncosted white paper to try to guide the state in pushing out a statewide platform. I don't know how that would be funded. The state does have CARES money, and then there's also could be through block grants or some other method. But I think it's the fact that we're wondering about funding this system in the middle of a pandemic is just reflective of decades and decades and decades of underfunding for public health. And so, even post-pandemic, if we can learn anything from this one, it's that we need to fund infectious disease security for our society at a robust level to keep us safe and kids in schools and things. Thank you.
Very helpful. Have one sort of broad question. Is surveillance here to stay, or will the motivation fade once vaccines are widely available?
I can speak to that if you'd like a little bit about vaccines. And so the first generation of vaccines are going to be not quite what we think of vaccines, the general public thinks of a vaccine. I think the general public has this idea of a vaccine similar to the measles or to chickenpox, that you get a vaccine and then you're never at risk for that pathogen throughout your life, or maybe you get a booster when you're 18 or 20. The initial reports out of the first vaccines that they're going to be effective at reducing disease, but maybe not preventing infection. And so we have this potential to where we have vaccines beginning to become available. And I'm in the camp that, you know, those are going to be widely available maybe late next year, similar to what the CDC estimates and the FDA estimate. And so as these vaccines come available, we may not know just how effective they are, and they may not prevent transmission, but just disease. And at that point, the question is, can wastewater surveillance still support the public health response to the coronavirus? And I see two ways that it does. The first way is to help guide the distribution of vaccines. The logistical challenges of delivering vaccines are going to equal the scientific challenge of developing a vaccine. And those operations are going to be super complex. And so in order to reach a high vaccinated population, you know, you have not just the distribution, but also the public health messaging and the buy-in from the public. So can you use wastewater surveillance to say, look, here in this neighborhood, we have a spike, here's this vaccine available, and try to prioritize the distribution that way. And then the other way that it would be useful is to, in a cost-effective and a transparent to the public way, to measure the effectiveness of this vaccine. As the vaccine rolls out, the wastewater levels should go down quite significantly. And so I do see a value of wastewater surveillance continuing for at least a year, and for coronavirus for at least a year, maybe beyond. And then also put a plug in, if we had wastewater surveillance in January of this year, our lives right now would be very, very different. If we had a national network that was able to understand that, we had the China travel ban established because we thought it was coming in from China. We didn't realize at the time that it was also coming in from Europe, but that would have been very clear with a national surveillance that if we had public health, infectious disease security in this country, then we would be in a different situation right now.
Helpful.
Yeah, and just to add on to that, I mean, Dave makes some really good points there. I'm a little late on my flu vaccine, but having just got it, I'm thinking about influenza, right? And how, potentially useful wastewater could be for allocating resources for something like that, or other pathogens. They have to be excreted, right? If a pathogen's not excreted, it doesn't end up in the wastewater. Wastewater surveillance is no good. So I think this is really where we can be creative, and really think about all of the ailments that affect society, and think about, well, what checks the boxes as potentially being useful for surveilling in wastewater. Tong's work with opioids and substance abuse, right? So it's not just pathogens where wastewater surveillance could really be useful. There's really, I think it's around to stay. I don't know if it'll get this much attention in the future, but all signs, I think, in my mind, point to this is around to stay, and it will continue to expand and become more useful the more we learn about how to use the tool and how best to use the tool.
I just want to say, at a campus level, we very regularly get issues with influenza outbreaks. So we have the infrastructure in place now to monitor the campus for influenza, even if, and I'd say that COVID will be around for a long time in some form, shape, or the other. potential for outbreaks, but I can see the application there in terms of monitoring our wastewater for influenza. That's at a campus level, that's extremely useful. Unfortunately, I have a hard stop at 3:15, so I'm sorry about that.
No, that's okay. Thank you so much, Lachlan.
All right, thank you.
Yep. I think that was actually a good question to end on. And we unfortunately did have some outstanding technical and application questions, but we can follow up with the speakers on those. But just want to thank you all very much. Thank the panel for their insights and experiences that they shared today. And thank the audience for sharing your questions. We will cull through your ideas for future panels or presentations like this. Again, there seems to be at least a fairly strong interest in these topics. So we'll be in touch soon. And just thank you again. I'll hand it over to Savannah to just wrap things up.
Thanks, Kristen. You know, as it's indicated here on the slide, in the follow-up email that you will receive after this webinar, we do have a link to a survey. You know, please let us know your thoughts on today's session, as this does help us plan for future sessions that are important to you. You know, lastly, thank the panel and Kristen for facilitating today. Expertise was wonderful. And so on that note, any questions that you may have should be answered in the follow-up email, but you can also reach out directly. So thank you all so much. If Kristen or the panel has any last, you know, closing out comments, please do so.
Yeah, does anyone have anything?
Thank you, everyone.
Wonderful.
It's been a pleasure.
Yeah, thank you.
Have a great
Good to
afternoon,
see you.
everyone.
Thanks, everyone.
Thank you.
Nice to see you.
Yeah, you too.
Okay.